Hey y'all, and welcome to the Max Life. So today's video is going to be a short video update on Aiden. Yes, we've been busy. Yes, we've been running around doing all the Christmas things. Hence the reason why I just kind of stopped and had to come back in my bedroom just to kind of get away from everything and pull the camera out and film for you guys. So if you missed the first story, y'all go back to my very last video. It's where we basically had to take Aiden to the emergency room for his heart. He's having some crazy fluctuations with his heart rate, but I want to give y'all an update from where we were last video update. The very last part was we were waiting to see the pediatric cardiologist that we had lined up. It's about an hour north of us in a hospital. It's a clinic within a hospital in our Jackson area, which is our capital here in Mississippi. So we did go to the appointment, and I have a lot of mixed emotions, feelings, thoughts about that appointment. So we got up there and we waited for a while to go back and see the pediatric cardiologist. My first question, and let me explain myself, so y'all please do not start throwing stones at me, okay? So I knew when I called and set up the appointment that my insurance, of course they ask you for all that information. My insurance does not cover. We are what's called Christian Care Ministries, or MediShare, some people call it that. So this specific doctor is not considered in the provider, but he is actually from our area, and I know a lot of people around here who have wonderful testimonies as using this pediatric cardiologist as their primary care physician when their child has had any kind of cardiac problems. So since I already knew that, I really wanted to see him because I know a lot of people that have already used him. So in setting this up, she told me walking in the door and going ahead and setting up, you're already scheduled for an echo. It's going to be $1,200. I just wanted to let you know that. That's just like what you're walking into. So I told her that was fine. And then the more I got to thinking about it, I was like, we're walking into this, but wouldn't it be wise to speak to the doctor first and make sure that he needs this before we do it and have to pay for it, and him think that it might not even be related to what an echo would show. So that's what I told him when we first went in. We were signed in, we were waiting, and I went up to the window and just said, hey, is there any way that we could meet with the physician first before we have this echo done, and let us tell him what we've been experiencing before we have this test done? So they said, sure, that's fine. We go to the back, we tell everything to the nurse, and then have to tell everything to the doctor, or we tried to get most of it out. He was in and out about 10 minutes, 15 minutes at the longest. And it's a lot to tell in 10/ maybe 15 minutes. So after everything is said and done, they did check his blood pressure 2 times because his blood pressure was a little elevated. He did mention possibly doing a tilt test with Aiden. I told him that we didn't want to have the echo done unless he felt like it was absolutely needed based on what Aiden's been experiencing. So I'm trying to get my details in line, y'all, because a lot happened, and I'm trying to get it out in a way that y'all will understand it, and I'm not missing anything, because a lot of you guys will comment, well, this and that, and it's not that it didn't happen, but it's hard to tell y'all every single thing. So he said on the echo part, this is where we're at with that he didn't feel like it was needed right then, but if this continues, that Aiden will have to have one done, which we're totally fine with. And I did think of a way around having it done there, so I'm not out of pocket, but I'll get to that in a minute. So also, he basically said, okay, I looked at everything that was sent over from the ER. They did do a repeat EKG. So we had one done in the emergency room. They did repeat one there. Of course, all of that's coming back normal because this is random. Aiden's heart rate is not staying up. It will, so say he's sitting down on the couch and he has an episode and he feels it. He can just feel that his heart, it goes up. As fast as it goes up, it starts coming back down. Okay, say he's been sitting on the couch and then he gets up and stands up and starts walking around. He can feel it go up, and as soon as it goes up, it comes back down. So whatever it's going to go up to, whether it's 130, 120, 110, or just 100, usually it takes getting up to the 130s and 120s before he can feel it. But he does have a running watch that is it is not an iWatch. It is not related to any of the iPhone, 5G, none of that. He just has a running watch that can track his miles, how distance he runs, his time, and his heart rate. That's the extent of the watch. But he can monitor his heart rate with that. So when he stands up and starts moving around, or whatever he's doing, when it goes up some, he can look down in his watch and actually see what his heart rate is. So going back to the appointment, when we're explaining all of this to the doctor, he was really nonchalant about it. He didn't want to repeat. He didn't ask for any other type specific blood work, so we didn't do any other blood work. He did talk about the tilt test and said that may be something that we need to do in the future. For now, he wanted to put Aiden on a monitor, so he's on a 7-day monitor. This is actually the monitor that he's on when he is done with the 7 days. There's like a shipping label in here where we'll repackage the monitor up, mail it to this company. The company obviously will upload all of the information and send it over to the pediatric cardiologist, where we're hoping that he is going to thoroughly interpret the results, and he is supposed to call us back. It's going to be around 2 weeks, but this way, so with the EKGs, you have to actually catch it when it's going on. And like I said, for Aiden, it's really random. So to put a EKG on for a couple of seconds and capture a heart rate, that's not going to pick up what's happening to Aiden. So with this, they're going to actually be able to see when his heart rate goes up. He's supposed to be writing down the date and the time that he feels it and record that, so that the date and time will correspond with the date and time. What he's doing, they can kind of look and say, okay, he was just walking around and this happened, or okay, he was jogging or eating or whatever he was doing. They can kind of correspond those times with what he was doing and what they see on the monitor. So that's where we're at right now. He does want us to come back in 4 weeks. So one other thing that he did mention when we were in there, because he didn't seem to know, he couldn't like really tell me why he thinks this is happening. So I was just kind of like asking questions. Well, like, okay, you're the pediatric cardiologist. You hear what's going on. What, in your opinion, what are some possible causes that is causing this? And he basically said he didn't know. And the only answer that I actually got was that there's this organism floating around, and it's actually called Mycoplasma pneumoniae. Hope I didn't totally slaughter that. It is a really long word. But essentially, it is an organism that is a bacteria that does not have a cell wall. And most of you guys will be familiar with the term walking pneumonia, which has been like super rampant in kids this fall and winter. I actually believe that's what Livy had several months ago. She was on breathing treatments because she was sitting up at night coughing so hard, having these coughing spells through the night because she couldn't breathe. She was actually coughing so hard that she was puking. So that happened 3 nights in a row. But the breathing treatments, and they added some steroids in there and an antibiotic, and we were able to knock that out. We did not have to go to the hospital for that, but we do have some family members whose children ended up with very similar symptoms, and they did get hospitalized for whatever this is going around. He says that that infectious disease has been reporting that a lot of children that are picking this up are having crazy spikes in their heart rate, like their heart will race from time to time, you know, like these similar symptoms that Aiden is having. So he feels certain that it's infectious disease related, and he actually said, if I'm a betting man, that's what I'll put my money on. But I stopped him and said, okay, I would get that if we were talking about my 4-year-old, because she was really sick. Like, I totally get that. Aiden has not been sick. He has not been sick anytime soon. Not that I can even remember. Aiden has not coughed. He has allergies, so he sneezes from time to time. No runny nose, no fever, no swollen lymph nodes. Like, he hasn't been sick. So are you saying that Aiden has been sick and that he has, and this is causing the spike in the heart rate? And he says, yes, this is just what we've been seeing. And I'm like, but Aiden hasn't been sick. So, and then he says, well, some kids are just asymptomatic, means they're not showing symptoms. So I'm like, I don't know about all of that. So I agreed to just, this is the first step for sure that I felt like we needed so that they can catch what's going on. The rest of the jazz, I'm not really worried about right now. Let's just watch what's going on the monitor and we can go from here. Now, a couple of things that I come home, because my motherly instinct tells me I need to continue to dig into this to find out what's going on. So I come home, I did a lot of reading. Actually, that night I was up to like 1 o'clock at night just reading and studying and trying to learn all the different things that could cause what Aiden's dealing with. And a couple of things that was not ever mentioned to me. Now, they said that his thyroid was fine. Apparently, when most patients go into the hospital and they suspect that the thyroid may be off any, they look for what's called thyroid stimulating hormone. Aiden's was normal, but they did not tell me if they checked his T3 or T4, which is a different test that can also indicate that your thyroid is not actually working properly, even though your thyroid stimulating hormone says that it is. It's just a little bit more deeper. So I really want to have that checked just to make sure that's okay. And then the other thing I was considering was maybe his adrenal glands, because he is in that funky, like, growing teenage years. So I really do want to have his cortisol level checked, just because that's a direct reflection of his adrenal glands. And so those are the 3 things that I'm considering that I feel like need to be checked. So this is what I called, actually, this was yesterday, Friday. I called, but they were already closed. They closed at lunch. So I have a note to call Monday and ask if those were checked. If they were, I want to know if they were normal. If they were not checked, I would like to get those checked. And also, going back to the echo, so our hospital that is here in our town, anything that we have done there, it's in the network of my insurance. So if our insurance is not going to cover it there, the next step I'm going to be concerned, or I'm going to be trying to gear towards is, yes, we want to see this doctor, but if it comes to those type testing, can we have them done here so that we're covered, and then he can send the results up there, or we can have the results sent up there. So I really would like to have his blood work done here. I'm going to call Monday. That's like the next thing on my list, and say, hey, was this done? If it wasn't, can you send an order to our hospital here? It's like an outpatient thing. So we basically just go in and say, look, my doctor needs this. He's not from here, so I need to get this done, and y'all send the results to him. The same thing works on the echo. So if Aiden is not any better, then we can have the echo done here. It is covered by my insurance. This is all like an after the fact, like, thinking, because it's a little overwhelming, to be completely honest with you. I'm trying to juggle him and all the other things with the other kids, the farms, it's the holidays, it's family stuff, it's extra cooking. So I'm trying to make sure that I think through things well, and that we're not missing anything, and that, you know, all the pieces of the puzzle we can just put together. So that's kind of where we're at right now. He's on a monitor. We'll be waiting on those results. I do want to check some specific labs that probably was not checked. So we're going to go ahead and follow through with that. And then in 2 weeks, I'm supposed to be talking to the pediatric cardiologist, and we can kind of see what's going on. But the good news is this. I have been giving Aiden a magnesium supplemental drink. It's actually called Calm. I got it many years ago for, I had an eye twitch. Sometimes, like Eliza told me several months ago that she had her eyebrow was twitching, and y'all, it really zaps those things right out. I had a friend tell me about it after 2 years of an eyelid twitch, and she said, you need to try that. So after about 3 or 4 days of drinking that magnesium supplement, it worked. So again, Eliza had this eyebrow twitch. This has been a little while ago. I gave her the magnesium drink and it worked. So I have Aiden drinking some supplemental magnesium once a day. He's drinking a cup of it. He did tell me all day yesterday his heart rate did not go up over 100. He didn't feel it. We checked the watch, so you can go back and look at the heart rates that have been captured through the day. The highest was 100, which is still not normal, but it is getting better. So I'm hoping that the magnesium is helping. If it is infectious disease related, I'm hoping that we're getting past all that. So we're just going to move forward from here, monitoring him really, really well. I think that whatever is going on, this is definitely going to show it, and then we can progress forward from here. So thank you guys all so much for the prayers. I know a lot of you seen the video, told me your experiences and your thoughts, and I went back off and went back to the internet and a couple of different places, just reading to see if there could be some connections. So I thank you guys all for sharing and for praying. That means the world to us. Thank you guys so much for watching and supporting our channel. It really does mean a lot. God bless. Merry Christmas to you all, and happy homesteading, y'all.